Hello students, this is an important topic that is geriatrics and we will focus mainly on health problems of elderly. This is geriatrics is a very vast topics and it is as such a specialty, a medical specialty. So we will not go into the all the details, but what is required as a undergraduate or postgraduate students in community medicine. So in today's lecture, we will focus just only a part of this topic that is health problems of elderly. Let's now start. The health problems of elderly are broadly classified or we can categorize into three groups. These categorization based on the public health or clinical practice point of view. One is that problems that are affecting elderly people of both the groups and then the problem affecting mainly the elderly males, okay, and then the problem affecting mainly the females. So we will discuss it step by steps. Today in this lecture we will focus on this part, that is problem affecting elderly people of both the genders. Okay, now let us move to the next slide. The uh, health problems affecting elderly people of both the genders. So firstly, this ocular disease. With the progress of age, with the increase in age, the people suffer from the various kinds of the diseases. And for in the ocular disease, there will be diminution of vision, and they may suffer from the cataract or glaucoma. All these problems, that is cataract, glaucoma, diminution of visions, they decrease their ability to earn, then ability to communicate, or ability to interact with other people. So this is very important problem in elderly age group, that ocular diseases. Then the next is hearing defect. Due to reduction in acuity of hearing, there will be difficulty in communication, and they will suffer in day-to-day basis while communicating with other peoples, even with their family members. It ultimately leads to their emotional isolation. Then other problem is reduced muscular strength and coordination, reduced lean mass, then reduced flexibility of muscles, then neuromuscular coordination, reduction in this neuromuscular coordination. Ultimately, all these things leads to the injuries and make these elderly people prone to various kinds of injuries and accidents. Okay, as we discussed in the previous slides, accidents and injuries. So falls are responsible for majority of injuries are due to the falls. Okay, they suffer falls. The common places of accidents are toilets, due to the wet floor of that toilets and the large number of fixtures in a very small space. They suffer various falls and other injuries in toilets. Then kitchen, mainly due to open flames. Then in staircases and roads, they suffer the accident and injuries. Okay, now next health problem is the nutritional deficiencies. They suffer from the malnutrition, especially in this age group, in elderly people. They suffer. The reasons can be due to lack of financial resources to buy nutritious food items, then the reduced ability to go into market and buy raw material. They do due to there's a weakness or due to neuromuscular weakness or neuromuscular coordination, weakness of muscular strength. They sometimes they are not able to move out to go into the market to buy the raw material for cooking, for the food items. Then reduced ability to cook nutritious food items. Then orodental problems, they have difficulty in mastication, there might be reduction in the taste sensation. All these things contribute to their nutritional deficiencies. Then the dental problems, they also suffer from these dental problems. They in the latter age group, no, in latter ages, they people have less number of teeth, and some may having this no, ill-fitting dentures. They interfere with the mastication and desires to eat. So they have, when they have less desire to eat, when they have difficulty in mastication, ultimately it leads to the malnutrition. Then they also suffer from the cardiovascular diseases like manifestation of arteriosclerotic process, actually that mainly appear in later age group. For example, these people have, they are prone to, or they suffer mostly from the stroke, hypertension, they have ischemic heart disease related problems. Then from the pulmonary disease, they have chronic obstructive pulmonary disease that often lead to pulmonary, that is congestive heart failure. Then arthritis and spinal disorders. Actually, due to degenerative osteoarthritis, these people have pain and they suffer from the arthritis. Also, they are more, these complication of this chronic disease like diabetes, they often appear in the latter part of the life. The microvascular and macrovascular complication, they are more prominent in this advanced stage. Finally, the cancers, the oral cancer, lung cancer, gastric and colorectal cancers, they are common in elderly age group. Student, this was all about in today's lecture. We will continue this topic in the next sessions. Thank you and have a nice time.